Healthier alignment is better function, better mechanics, better longevity, and it's going to affect, like I said, function. It's going to affect even how they move. Hey everyone, Dr. Todd here from Gonstead Spine and Wellness. Today we're actually going to go through a traction training with our team. So traction is something we do in our clinic. We're going to talk a little bit about why it's important, why you should care, who's a candidate for it, what it does. But really what I'm doing is bringing you behind the scenes so you can see how we train our staff on this. We go through lots of ongoing training clinically, procedure-wise, because when you have an operation that's handling all the things that we do for a patient, there's a lot of moving parts, there's a lot of ongoing training, and we're always striving to be at a higher level of clinical excellence and work better for our patients. So before we get started, make sure that you subscribe to our channel if you haven't already. Share this. Put comments below. We will respond to comments. Let us know what you think. Let us know if you've ever done spine remodeling traction like we're going to cover today. If you have specific questions as far as if you want to know if this is going to help you, if you're a candidate, throw some comments on, throw some questions on there. We'll be happy to get back to you. We serve two audiences. One is our community that wants to learn how to get healthy and stay healthy for a lifetime, our patients that are out here in Idaho, and those that want to even travel in from out of state that come and visit us. And the second audience that we serve is chiropractors. We teach chiropractors how to put functional movement and corrective exercise into a chiropractic practice, how to do stuff like we do stuff. So with that said, let's get going. There's Helena right there, ready to rock and roll. There's the team. The normal curves of the spine. This is the side view of the spine. You should have a forward curve in the neck, a backward curve in the mid-back, and a forward curve in the low back. Not too much, not too little. So kind of like the porridge thing with, what's it called? What was that?
Oh,
the three little bears?
No, just
Goldilocks.
something.
Goldilocks, there you go. So it's like the Goldilocks principle, right? And so now this has been defined on how much you're supposed to have, and most people, if they have normal anatomy in the pelvis is what actually drives the curves of the spine. You should have about a 40-degree low back curve, 44-degree mid-back curve, and about a 30 to 42-degree curve in the neck. And there's ranges of normal, just like blood pressure. This is all established, measured on x-ray, stuff that we figured out as the doctors. We dictate this to our team so they know what we're doing traction-wise, but again, this is the why behind the scenes as far as why we're trying to improve a curve to put them into a healthier position, because a healthier curve, healthier alignment is better function, better mechanics, better longevity, and it's going to affect, like I said, function. It's going to affect even how they move. So, like, for those of you out there, clinicians who are watching this, and if you have a patient that's got a thoracic hyperkyphosis and it's rigid, and you're doing lots of exercises to try to improve it, but the thing that's stopping them is really deep, rigid ligament, deep muscle, you have to remodel that. You have to do some type of spine remodeling traction to change it. It's not going to change with exercise or adjusting alone. That's where traction is so needed.
Do you know where everything is placed? Like if you had to go grab that strap, if you had to grab the ASI strap, if you had to grab the blocks, do you know where those are located?
Yeah, the straps are right over there.
Okay.
The hook, and then the large blocks are on the bottom.
Good.
Medium blocks are on the second one, and the small ones are on the top.
What are you doing in here? What? Let's see what you're doing. Show us how you mark x-rays. Show us how you do it. Why are those x-rays so blurry? Who took those?
Not me.
Oh my goodness, they're fired.
Well, let's have Helena. How would you start out with this? You just have them lay down and then you place the straps
I have
later?
them lay down. I pay attention. So the medium block, mid back, I actually watch them lay down to make sure the block is in the correct spot. So I would like stand right here and like almost kneel down as they're laying down.
Okay, Dr. Todd here. I'm going to narrate over what's going on. So this is a lumbar traction. So meaning we're trying to increase the curve in the lower back. And these blocks that Helena's laying on here, the reason that she's laying on blocks is because that shifts the part of the body that she's laying on forward in relation to, in this case, her pelvis. Why are we doing that? Because her abnormal posture, or the abnormal posture of the patient that we're demonstrating here in this traction, their posture is shifted backwards. So we're trying to shift them forwards. In addition to shifting them forwards, we're also trying to increase the curve in the lower back. So essentially, if someone shifted a certain way or bent a certain way, we're trying to bend them the other way and bend them a little further to remodel the shape of the spine. There's various straps that are controlling parts of the body to do what's called 3-point bending. So if you have a point here, and then a bend in the middle, that's 3-point bending. And in this case, the human spine is the material that we're bending. So various angles, various straps, everything is done in a certain order. Again, this is a traction training that we're doing for a newer staff member, showing them some of the specifics of this. This is what makes this aspect of our clinic so unique and different, is the fact that we do this in combination with addressing the segment and the movement. This is the posture part. Okay, so now that we've gone through the traction setup, I want to show you x-ray wise what exactly we're looking at that would show how this patient needs traction. You're not going to fix a patient like this without traction. Let me pull up another x-ray so you can see all the markings on here. But first off, before I get to that one, we take a full spine x-ray of our patients. So this one is as if we're looking at the patient standing behind them. This is the left, this is the right, and then this is a side view of the spine. It's a full spine x-ray. So you see from the base of the skull all the way to the bottom of the sacrum or the tailbone. There's some markings and analysis that we do here in the Gonstead system. We also use a whole other type of line analysis in a technique called Chiropractic Biophysics, which is looking at curves. So I'm gonna pull that one up and we'll jump over here and take a look at this one. Okay, so this now is a little bit of a different type of analysis compared to the standard Gonstead analysis. This is a side view of the spine. Again, it's the same side view. The green line is the ideal line of where this person should be positioned. This is based off of the height of someone's vertebral column. So it's not just some arbitrary line that's put up on their spine that everyone has to match. It's based on their height. And this is, again, called the ideal spine model. And about 85% or so of the population can probably fit this. There's some variables, some anatomical things that can happen down here in the pelvis that would alter someone's ability to ever accomplish or reach this ideal range. And in those cases, we adjust that ideal curve based on the person's unique pelvic anatomy. It's called pelvic morphology. We'll talk about that in a different video. In this one, I just want to show you simply the green line is where he should be. The red line is where he's at. You can see that he is not near the green line. They want to be on the green line or even slightly in front of it, but never behind it. When you're behind it, there's way more stress and way more abnormal load that acts on the back parts of the vertebra and the back of the discs. And in this case, literally each bone is shearing and shifting backwards on the bone beneath it. This will cause tons of undue stress to the joints, to the discs, to the ligaments, has lots of opportunity to stress the nerves. Just in this position, the spinal cord lives in this little space behind the red line. So imagine a spinal cord. Imagine that spinal cord being like a bungee cord. If that bungee cord was behind the green line, it would be nice and relaxed. In this case, it's stretched. And so just like a bungee cord, if you stretch it, does it get thicker or thinner? That's right, it gets thinner. Looser or tighter? It gets tighter. So the spinal cord in this case, and the 31 pairs of spinal nerve roots that exit off the spinal cord in between every vertebra is taut and stretched. And those nerves control every single cell, tissue, and organ in the body. So this isn't just about trying to prevent or slow down arthritis. It's not just about trying to stop back pain. This is about function of your central nervous system, which in this case is looking at spinal cord health, okay? So what we do, we pull this forward. The traction setups that we were showing you earlier to increase lumbar curve would be appropriate for this type of case. In this patient, we would want to actually pull the rib cage. This is the rib cage right here. We want to pull the rib cage forward and help induce a curve in the low back at the same time. This is also an abnormal neck curve, but this is not the top priority. We have to prioritize care for a patient like this. This is the biggest elephant in the room that we need to change. So that's a summary of the x-ray analysis of why this patient must do traction. All right, we are in the exercise area. This is our functional movement area. We have our belt system of functional movement up above right here. So our patients' names get up on the wall, they get a wristband. I'm a black belt, that's why my name's up there under the black belt. There's not a lot of black belts because it's hard to get there. And this is where our patients learn postural corrective exercises, functional movement exercises, so to improve functional movement, so addressing mobility, ability to move, otherwise thought about or referenced as like flexibility, right? So mobility, stability, so the ability to be stable, support other structures of the body while other body parts are moving simultaneously. That's stability. That's very important to prevent injury, keep the body strong and functioning. And this is also an area where people do warm-up exercises before they get into traction. So all of this stuff back here is handled in a variety of systems and ways to make it very efficient so that our patients all get customized individual care. We can progress them so they're not just doing the same exercises every time they come in, and we can meet someone where they're at. We have patients that are in their 70s that have never exercised a day in their life, and we're able to appeal to them and keep them engaged and teach them, really important foundational movements that are going to carry over into everyday activities. And on the flip side, we have patients that are elite athletes that already know a lot of the basic exercises, or they're competitive athletes that know a lot of advanced exercises, and we help improve their performance. Again, we meet them where they're at so they could strive to move further along, where am I pointing, in our belt system of functional movement while they go through care. So this is the exercise component, which is really the third part of the three-prong approach of addressing segment, posture, and movement. We showed you a lot on how we do traction setups, we showed you x-ray analysis, and we also do specific segmental adjusting. So back over here in the adjusting room, this is where patients get their spine checked each and every time they come in for one of these corrective rehab visits. We identify what segments of the spine are problematic at that moment. Typically, there's a trend in that we identify problematic areas, maybe 2, 3, 4 segments of the spine out of 24 segments in 2 parts of the pelvis, and some other stuff going on in the sacrum. So there's multiple things that could be going on. We hone in and identify where their primary problem areas are. We check them to see if that's changing from visit to visit, and then we specifically adjust them using various tables and equipment in the Gonstead method. So that is a summary of how we take a patient through care and the importance of not just traction, but the other pieces that all come together to really get to the root cause of the problem. All right, thanks for joining us on that traction setup. That just gives you an idea of some of the moving pieces of what we do in a corrective care clinic. So this is truly corrective care. We're trying to change posture, change curves, change the spine, have a before and after x-ray, not just treat symptoms, get someone feeling better, and then say, okay, great, your symptoms went away. We want to get structural and functional changes that we can physically see and measure so that people have long-lasting results and we dig deeper and get to the root cause of the problem. All right, so if you haven't subscribed already, subscribe. You have some info here to reach out to us if you're looking to get checked out as a patient. You can reach out to us if you're looking for other doctors that do this type of well-rounded approach. And if you're a chiropractor and you want more information on the systems that we put in our clinic to make something like this work, check out movevalue.com. Dr. Todd signing out from Gonstead Spine and Wellness. When it comes to the health of you and your family, results matter most.